Healthy moms mean healthy babies, and healthy moms are the center of the family, which means they're also the center of the community, and they're center to our economy. And so when a mom does well, her children do well. I think of a mom that I've met a long time ago in Kenya, and she said to me when she's holding her little baby in her hands, her newborn baby, she said, "I want every good thing for this child." And her name was Marianne. And I thought, she encapsulates what every mom wants, which is every good thing for their child. 800 moms die a day in childbirth. And by the time you finish watching this brief but spectacular episode, another mom will die in childbirth. That just does not need to be. Many of the interventions for maternal health are actually quite simple. It's using something we already have and that we all use, azithromycin, so that a mom doesn't get infected at the time of the birth. Or it's IV iron, making sure that gets out to moms. Yet in so many of these low-income settings, those simple interventions and tools are not making it out to where moms give birth in healthcare facilities. When I've traveled to Malawi several years ago, I actually saw on a warmer in a healthcare system a baby that was likely to see out the day, very healthy newborn, and one who had been born on the road, and the mother had died. And that baby, because of the birth complications, was unlikely to see out the day. Here in the United States, a woman is 3 times as likely to die in childbirth than in another high-income country. That just should not be. And it has to do with a system failure, a system that doesn't listen to women, a system that's biased, a system that doesn't spend enough money rolling out the innovations that we know that work. So we need to follow the data that shows us where these places are in the U.S. and demand change from our government so that the health systems support all women in the United States. The single biggest barrier preventing us from saving these moms' lives in childbirth is not focusing on them and saying, this matters. Every single mom's life matters. If we did that, we would spend more money on health systems. We would spend more money on women's R&D for health. We would make sure that the regulations pass so that as new innovations come out, they get out swiftly into the healthcare system. We need to say to ourselves and mean it that all women matter, no matter where they live in the world. I met a group in Africa who had really said enough is enough in their community. They said, we're tired of seeing our sisters die in childbirth, our moms die in childbirth, our wives die in childbirth. Let's do something about it. And so this group banded together in the community, and they literally together over a couple of days listed what was keeping women from having adequate healthcare system. And then they took action. And I thought, that's what it takes, is a group of committed individuals to take action on behalf of others and to say, women in our community matter. And if we did that all over the world would change. Why do we put women second, or women's issues are a nice to do thing, or maybe when we get to it? No, when you put women front and center, my gosh, the world changes. And guess what? The next generation changes because they see these more powerful moms in their homes or in their communities, and they say, I want to have a wife like that. I want to be a mom like that. So it gives young girls and boys a different view of the world. And to me, that's just really exciting. When I see healthy moms and babies, it just lights me up because I know that feeling when you have a child that you care about so much, you want to do anything and everything for them, right? And I love that no matter where I go in the world, you can sit on the ground with women and they will talk to you about their children and I'll talk about my children, right? As if we're neighbors with one another. And there's a community amongst women. And I've asked women before, how do you know when there's a new health innovation out or something that can save your life? How do you know? And the women look at me like with this wisdom and also this curiosity, like, how can you ask us that question? Because they'll say, you know what? We talk. We talk at the birth of a child. We talk when we're grinding the millet. We talk when we go to the well. And they say, don't the women in your country talk? And I'm like, actually, we do. We all share information about our bodies and our health so that we can all be more healthy. When I was becoming a new mom, I was lucky enough to have a doctor who was very experienced. And he talked to me not only about my healthcare needs, but what it was going to be like to be a new mom. And he listened to the pressures that I was under. And I think every woman who goes into a healthcare system to deliver a baby or is met by a healthcare worker, they want their story to be told and they want their stresses to be understood too. So there are places in the world where, after childbirth, somebody will say to the woman, well done for getting through the dangers of childbirth. And what I look forward to is the day that comes in the future where we just say, well done on having a healthy baby. That we don't even have to talk about the dangers of childbirth because they're behind us. And that is just a joyful day from start to finish. Maybe exhausting, but joyful and not scary. So I was lucky enough to be with my daughter, Jen, and her husband, Niall, at the birth of their own daughter. And to see your own beautiful, healthy daughter give birth to another healthy baby girls is just one of the most joyful times in life. It feels just absolutely full circle. And at the same time, I could be in that delivery room, and I've been to many delivery rooms around the world, and I know the difference in those places. And I could think about other moms on that day where their experience wasn't as joyful or the setting wasn't sterile and clean. And so for me, with the birth of a granddaughter, it made me all the more committed that in this next generation, women have fantastic health care on the day that their baby is born and all the way through their pregnancy.